Okay, we're about a minute in and the numbers are still going up, so that's great. But we are going to kick off here because I know time is of the essence. So good morning, everyone, and welcome to today's event. Thank you all for joining us. My name is Chris Mann. I'm the Corporate Partnership Specialist with the Halifax Chamber of Commerce, and I will be your host this morning. We know now that public health organizations around the globe recommends getting your vaccine shot as the best solution to protect yourself and others from COVID-19. As more of our population is vaccinated, cases continue to trend downward, but we still have some work to do. Our business community plays a key role in reopening the economy safely. We want to ensure employers, employees, and customers understand the importance of having a clear policy to make your environment safe and comfortable while maintaining sustainable business practices. So thank you to everyone who submitted questions for our presenters in advance. When we get to the Q&A portion of the webinar, feel free to type any questions in the Q&A box below on your, it'll be on your webinar screen, and we'll try to ask them on your behalf as time allows. So I'd like to welcome our three presenters today. We have Tanya Tinsky, Karen Lockerbie, Senior Advisors of MC Advisory, and Ian Picard, Partner for McGinnis Cooper. Tanya focuses on human resource management at the strategic and operational level. Karen provides strategies centered around restorative design to assist government organizations, non-for-profit entities, and Indigenous communities to develop programs, services that are more innovative, effective, accessible, equitable, and inclusive. Ian is an advice provider as it relates to human resources, hiring, discipline, and termination. Welcome, Tanya, Karen, and Ian. Thanks so much for joining us, and I'll pass it along to Ian.
Thanks, Chris. On behalf of McGinnis Cooper and McGinnis Cooper Advisory, we're very pleased to be involved in this event today with the Halifax Chamber. Certainly, we hope today to answer many of your questions about COVID immunization policies and vaccination policies in the workplace. I just want to take 2 seconds and talk about MC Advisory. Certainly, at McGinnis Cooper, the partnership is very excited about the launch of MC Advisory. It was launched about 2 weeks ago in the market, but they have been working for the past number of months prior to the launch. It's a boutique firm. MC Advisory is a boutique firm servicing Atlantic Canada and works in the spaces of public service, business growth, and legacy, and the focus today in the people and culture space. The people and culture space has a variety of clients already, from small, medium-sized businesses to large organizations, and also in the public sector. And the focus of the people and culture practice at MC Advisory would be human resource program design and development, human resource strategy and workplace planning, and human resource delivery, everything from human resources as a service to policy development, which is the focus of today. So to repeat myself, we're certainly very excited at McGinnis Cooper with the launch of a sister organization in MC Advisory, which we believe is extremely complementary to what we do as lawyers every day in this marketplace. And we're certainly very excited about the future of MC Advisory. And I'm thrilled today to be presenting alongside two of my new colleagues, and Tanya and Karen. And with that, I will turn it over to Tanya to get us started with respect to the presentation today.
Great, thank you so much, Ian. So before we get started, maybe if we can advance the slide to the agenda. I just wanted to go over what we'll be covering today. So we'll start off with my colleague, Karen Lockerbie. She's going to provide a broad framework for public policy. Then we'll move on to Ian Picard, who will provide that legal landscape and some of the considerations that you need to be thinking about when we're talking about COVID immunization policies. And then it'll come back to me where I'm really going to take you through a hands-on 101 discussion around how you develop policy in general terms, but then overlay that with very specific examples of what might be included in the various components of a policy related to COVID immunization. And then we'll finish off with some other considerations when we're having discussions around COVID in the workplace, and we'll certainly have time at the end for some questions. So before we pass it over to Karen, I'd like to acknowledge that the land for which I am located today is unceded Mi'kmaq territory, and I pay my respects to the Mi'kmaq people in this territory, past, present, and future. So I will pass it on to my colleague, Karen Lockerbie, to start us off today. Thank you.
Thanks so much, Tanya. Hi, everyone. It's really nice to be here and to have such a great turnout. Thank you for joining us. I'm going to begin the presentation today with an overview of the public policy context of COVID-19 and vaccination, because it's really the public policy context that's informing our day-to-day experiences living with COVID-19. So broadly speaking, the public policy is really just a course of action, laws, and rules that are created by government in response to real-world issues and influences. And in this case, that's the COVID-19 pandemic. Pandemic public policy is ever-changing and a very broad topic, so I can't cover it all today. Really, my goal is just to give you a high-level overview, as Tanya mentioned, to introduce the more detailed topics that my two colleagues will be speaking with you about today. So let's start with a look at the global overview. It's already been nearly a year and a half since the World Health Organization first declared COVID-19 to be a global pandemic. And very quickly soon after, countries all around the world, as we know, began initiating emergency health and safety protocols, imposing social and business restrictions, and beginning vaccination research. Trials of the first vaccines commenced at warp speed just less than a year after the virus had emerged, and distribution of vaccines began in record time just around the 1-year mark. And I say in record time because prior to this, the record for fastest vaccination development and rollout had taken 4 years back in the 1960s in response to the mumps. So international organizations such as WHO and the World Bank are continuing to support immunization worldwide, and they've been working closely with governments and manufacturers to try and bring COVID-19 under control. And they're trying to do this primarily by speeding up the development of safe vaccines, supporting greater manufacturing capabilities, working with partners to ensure the fair and equitable allocation of vaccines for countries around the world. But having said that, only 24.7% of the world's population has received a minimum of 1 dose at this stage. And 3.32 billion doses have been administered globally, with 33.25 million administered each day. Having said that, only 1% of people in lower income countries have received 1 dose thus far. And these vaccination challenges are generally attributed to a number of factors, primarily including the cost, ongoing production and supply challenges, anti-vaccination activism, vaccine nationalism, and emerging variants. Despite these ongoing challenges, the global efforts are continuing to bolster vaccination rates as quickly as possible to help everyone recover, to get the economy recovered, and to reopen our world borders. So moving closer to home, having a look at the federal public policy overview, the first case in Canada was confirmed in January of 2020, and then the number of domestic cases here in Canada quickly grew. In March of 2020, the federal government began introducing a sweep of emergency health and safety measures, imposing social and business restrictions under the Quarantine Act, Aeronautics Act, and also offering relief under the COVID-19 Emergency Response Act, as well as other federal legislation. Canada has stated that its public policy objectives for its COVID-19 response are to minimize serious injury and illness and death, limit societal disruption, reduce the burden on the healthcare system, and to promote economic sustainability and recovery post-pandemic. To accomplish these goals, the federal government continues to take unprecedented actions to respond to the outbreak that continues to affect all aspects of life and work across Canada. Canada's vaccination rates are currently amongst some of the highest in the world, and the government has made very clear that vaccination uptake needs to continue if we're going to avoid a fourth wave and another round of tight restrictions. So the federal government is strongly recommending vaccination for all eligible adults, but it has not made vaccination compulsory. And some of the key reasons for this stance include the ongoing manufacturing and supply shortages, different levels of the outbreak that are being experienced between the different provinces that are resulting in different strains on the healthcare system, inconsistencies of the availability between provinces, the need to balance individual human rights and medical privacy laws against provincial and federal laws that require safe workplaces, the exceptionally contagious nature of COVID-19 and emerging variants, pockets of ongoing concern about the quick development of vaccines and whether or not they're safe and effective. So we know right now that the Pfizer vaccine was recently approved for children aged 12 to 15, and Moderna's approval for the same age group is currently pending, but there's still no vaccine at this stage for children under 12. The federal health minister has cautioned that certain people may be required to have vaccinations or proof of exemption from vaccination in certain circumstances, as is already the case with respect to certain types of vaccines and certain environments. Such as schools and particular workplaces. However, the Canadian government has made clear that it's likely to continue to be determined at a provincial level as things progress. The Canadian government has said that while work is continuing to develop international standards, Canada is not presently pursuing vaccination passports at this time, and individual provinces may continue to determine travel and other local requirements. That said, we are already seeing a public policy shift in tandem with both international and national vaccination rates. For example, while provincial restrictions continue to vary, the federal government is now allowing entry to Canadians from abroad without the need to quarantine or have post-entry testing, provided that travelers have documented proof of receiving both doses, and they have to have done that within 2 weeks prior to entry. And the government's taking a hard stance on falsification of vaccination records, and that can result in a fine of up to $75,000. Equally, foreign travelers are advised to avoid non-essential travel to Canada at all, but they are permitted entry if they have proof of full vaccination, and they also have to have proof of a negative COVID test within 72 hours of arrival, and they must self-isolate until they get a further test result proving that they're negative for COVID-19. So those who only have one dose of an approved vaccine or none at all may still enter Canada, but presently they still do need to quarantine. So looking at a provincial and territorial view, it was between January and March of 2020 that every Canadian province and territory declared some kind of state of emergency and began tightening both social and business restrictions as the evolving impacts of COVID-19 became better understood. And all provinces and territories are now in the process of adjusting those restrictions, having regard to the evolving circumstances in those regions. And they're in the process of rolling out vaccination programs in a phased approach. And again, while immunization is strongly recommended, none of the provinces have mandated vaccination for the same reasons as I mentioned earlier. If you're looking for statistics on vaccination rates, you can find them on the federal government's website, and most provinces also have the local vaccination rates posted on their website for each province, but I won't go through those here, but just to let you know where you can find them if you're interested. So moving specifically to Nova Scotia, the first state of official emergency was declared on March 22nd in 2020 under the Emergency Management Act and Health Protection Act. And as we all know, there are special measure orders in place in Nova Scotia that are periodically reviewed and updated, generally every 2 weeks, although more recently, sometimes less. So as we all know, at the height of the outbreak and frustration with some Nova Scotians not taking the health measures seriously enough, our former Premier, Stephen McNeil, coined the now infamous slogan, "Stay the Blazes Home." And for those of you in Nova Scotia, we often see that slogan on everything now from bumper stickers to t-shirts. And similarly, our current Premier, the Honourable Ian Rankin, has taken an equally tough stance on restrictions. Earlier in this year, in May, he courageously informed Nova Scotians that he will take whatever legal means are necessary and available to stop the spread of COVID-19 and to keep Nova Scotians safe, even if that means limiting individual rights for the collective good. And Dr. Strang, Nova Scotia's Chief Medical Officer, has a local, bona fide local fan club and was awarded the Lieutenant Governor's Award for Excellence in Public Administration. So all that to say that opinions on the provincial government's local management of COVID-19 response and vaccination administration do vary, but it seems to be generally accepted that Nova Scotia has adopted a rigorous and cautious approach, and it's been somewhat effective. So last week, Nova Scotia was cited as having one of the highest vaccination rates in the country, and the provincial government again reiterated its commitment to vaccination and to the vaccination campaign, noting that it's a vital step here in Nova Scotia to reducing infection and death, further easing social and business restrictions, and helping to revitalize the local Nova Scotian economy. So our reopening plan takes a phased approach to safety and safely easing the restrictions. And each phase generally is expected to last between 2 to 4 weeks, provided certain targets are met based on province-wide vaccination, the number of hospitalizations, and current COVID-19 activity. And we've recently just moved into phase 4 here in Nova Scotia. So your slide may say 3, but we're now in 4. And the purpose of this phase is to continue to further ease social and business restrictions, and also to allow greater travel into Nova Scotia and increase visitation for people with long-term care residents. So a couple of quick statistics. As of today, 85.2% of the doses delivered to Nova Scotia have been administered, and approximately just over 75% of all Nova Scotians have either received a first dose or scheduled to get one. So this week, Dr. String again reminded Nova Scotians that province is still in the race against COVID-19. These statistics don't mean that we need to ease up. In fact, they're still encouraging vaccination and encouraging people to mix vaccinations, and reassuring everyone that that is safe to do so. And vaccination remains a priority of the Nova Scotia government. It's a public health priority, and they're encouraging everyone to get vaccinated as quickly as possible. So in addition to the requirement to comply with special measure orders and public health guidance, COVID-19, as we all know here locally, has created additional workplace considerations and compliance obligations for businesses under safety legislation, labor law, and human rights legislation. And non-compliance can result in possible fines and penalties, but it may also influence community spread, pose serious risk to health and safety, and even impact on your workplace culture. And there's no one-size-fits-all approach to this. Every workplace has to have a sector-specific and site-specific risk assessment and protocols in place, which Ian will touch on shortly. And the provincial government has made it clear that businesses and individual citizens have a very important role to play in helping managing health and safety here in Nova Scotia and supporting the government's COVID-19 efforts to get everyone vaccinated and to recover the local economy. So as more and more people are getting vaccinated and employers are making plans for employees to return to the workplace, it's important now more than ever to make sure that you fully understand your workplace rights and obligations in relation to COVID-19, testing, and vaccination. So with that in mind, I'm going to hand over to my colleague Ian to address some of the key legal considerations that Ian recommends you keep top of mind.
Thanks, Karen. Certainly since March of 2020, back in prior to COVID, labor and employment lawyers, obviously like the rest of the world, didn't know anything about COVID and its ramifications. And since that time, I don't think a day's gone by that we haven't dealt with some type of a COVID-19 related question. And today, certainly the hottest topic is the question of vaccinations, mandatory vaccinations, mandatory testing, and what rights does an employer have in both a union and non-union workplace. So we can go to the first slide, Erica. So we're going to talk about three things today. First of all, the legislative landscape, and then what we can draw on from a case law landscape, and then I will answer in as direct a way as I possibly can the question of what we do about a mandatory vaccine policy for our workplace. The most important thing, as Karen just said, is that turning your mind to a vaccination policy or a testing policy for your workplace. It's not a one-size-fits-all scenario. The healthcare sector, meat packing plants, large operations where it's impossible to have any type of social distancing among the workers as you reopen, and customer-facing operations, which a large segment of the people on this call would fall into. Those would all be the most sensitive situations that would draw on a mandatory vaccine policy, or addressing that issue in your workplace of how to keep your workers and your customers safe, while still respecting the individual rights of your workforce. Large office operations with large footprints, a little bit different scenario. People who work in their own offices and don't have a lot of customer interaction in the office space, a little different scenario. So you have to look at how your business operates along the lines of what I just said. Obviously, as somebody just mentioned in the chat function, if you're unionized, then you have to pay attention to your collective agreement, and you have to look at your union as a partner. I doubt there's any collective agreements out there that have specific language on vaccinations or testing. I've certainly not come across one in the last 18 months. But I still would urge you to use your union as a partner as you move forward with a process in which to deal with this question of mandatory vaccination and testing. My experience to date is that unions are very much focused on some type of a vaccination type protocol in the workplace to protect those who are vaccinated and are coming to work. That seems to be their focus. That may or may not change, but that certainly seems to be the focus. There may be other unique factors. Certain segments of the population, for example, Indigenous people, seem to, at least in the early days, seem to have a higher probability of large COVID outbreaks, which makes a vaccination policy or a testing policy more critical in certain communities. Obviously, the case law when it comes to COVID, there isn't that much of it yet. Surprisingly, there would only be 5 or 6 high-profile cases that I will talk about today. But we know we have a fairly good handle on how courts and arbitrators will approach COVID, mainly because of analogous case law from about 5 or 6 years ago that swept the country with respect to mandatory flu vaccines, the whole mask or vax debate that happened in the healthcare sector that created a ton of case law in Ontario and out west in healthcare about whether hospitals and health and nursing homes could make the flu vaccine mandatory for their employees or require them to otherwise wear a mask. That was litigated right across the country, and that's created a ton of case law that I think helps us understand what's going to happen when we have arbitration decisions in the union sector or court decisions in the non-union sector about mandatory vaccine policies. Privacy law, and I know a lot of the questions that we got in advance, privacy law is a big part of this as well. People ask questions about whether or not your vaccine status is a private matter. People ask about whether your testing status is a private matter. So we'll talk about that. We'll talk about that as we go through the presentation. So the next slide, please, Erica. Every province in Canada, and some people ask questions about this, has their own emergency measures legislation. And within that emergency measures legislation in many provinces, it talks about whether or not the government has, under its emergency measures powers, the ability to make a vaccine or some type of a medical response mandatory. And so Nova Scotia is fairly silent on that issue. Newfoundland, as an example, says specifically that the province cannot make it mandatory. But picking up on what Karen just said, what I've been saying for the last number of months is at no time is Canada or Nova Scotia going to make, in my opinion, going to make vaccines mandatory. That's just not going to happen. it has too many political sensitivities attached to it. So the federal government certainly, I'm not even sure it has the power under the Constitution, but certainly the province of Nova Scotia or any other province is not going to make vaccines mandatory for all of its citizens. It may confuse the issue with travel and how you travel, but as far as being a citizen of that particular country or province, it's not going to make it mandatory. I just can't imagine a world where that would ever happen. So it will always be, in my opinion, voluntary. What becomes very confusing from a legal landscape about vaccinations, and people have already asked some questions about the negative side effects of being vaccinated. But where you have the intersection of legal principles is that the occupational health and safety legislation, which obviously wasn't created to deal with COVID, but it certainly applies, says that every employer has to do everything reasonably possible in any circumstance to ensure the health and safety of all its employees. And every employee shares in that duty to take every step possible to ensure the health and safety of them and all of their coworkers. So when you view that in the context of the COVID situation that we're in, it creates a very strong argument that an employer has an obligation to take a stance with respect to making sure that all of its employees are doing what's reasonably possible to make sure that their coworkers and that their customers are safe. And a strong argument can be made that would involve requiring in the workplace that if you want to interact with your coworkers and you want to interact with the public as an employee, that you would need to be vaccinated. Now, I'll talk more about some alternatives, which I'm sure many of you were thinking about, but you certainly have to take into account paying attention to your occupational health and safety obligation as you work through this question of a vaccination policy. So the next slide, Erica. So a couple of cases that have come about already, the 3 or 4 that I'm very aware of that have been decided mainly in Eastern Canada and in Ontario have been very favorable to protecting the public interest and taking whatever steps are required to make for public safety, which means restricting travel or creating some type of a vaccination policy with respect to your workforce. So the first case was Taylor versus Newfoundland, which was absolutely the first case in the country about mobility. So this lady was upset because she couldn't go to Newfoundland during the early days of COVID to see a sick parent, and they challenged it in court. And the Newfoundland court said, well, we're balancing interests here, so we're going to say that the interests of the Newfoundland population outweighs your individual interest. So we're going to say that the government's travel ban is constitutional, and that it's for the greater good, and that it trumps your individual interest. And what interests me the most about that case is that it relied on a 1907 U.S. Supreme Court case that dealt with the Spanish flu in New York City, in which the judge back then said exactly the same thing, which is your individual rights in very limited situations get trumped by the public interest, and protecting the public from the spread of a deadly disease is one of those situations where the public interest takes a front seat to your individual interests. So that's Taylor, and that sets a very clear precedent going forward. The other case that we all know about in the union situation is KVP. It's a 1965 case, but what it says is that in any unionized environment, you're allowed to create policies as long as the policy is not inconsistent with the collective agreement, as long as it's consistently enforced, and as long as it's communicated in advance. And as I said before, I can't imagine a collective agreement that would have a clause that would be inconsistent with a vaccination policy for the workplace. So the KVP case, even though it's from 1965, will be the case that will be front and center if you have a challenge from your union about creating some type of a vaccine policy. This case gets relied on in 80% of the arbitrations that I do in the labor world, which is where I predominantly practice, because it comes up every time you have a workplace policy. In a non-union workplace, you're dealing with your individual contract of employment. But again, I can't imagine any individual contract of employment either directly or indirectly impacting on your ability to create a vaccine policy of some sort. And as we'll talk about in a second, the consequences of not following the vaccine policy are really the crux of all this. So we'll come back to that in a second. So I just want to briefly, before we get to the meat and potatoes of this, just talk about the influenza cases, because I think they're very important. And sorry, before I do that, there are two other cases that aren't on the slide that are very telling about where we're going, I think, on vaccine policies. First of all, there is an Ontario case where an employee refused to follow the quarantine or isolation restrictions, whatever the proper word is. He had traveled outside of the country. He had come back. He lives in one of the border states. He lives in Ontario, and he went to Michigan or Detroit just for a couple of hours and came back, and was supposed to, under the rules at the time, isolate for 2 weeks before he went to work. He didn't tell anybody that he had crossed the border. He went to work. His coworkers told on him, and he was terminated. And the arbitrator upheld the termination without any hesitation and saying that was a significant violation. It was a very clear order under the Ontario emergency order that he had to isolate. He didn't tell. He put all of his coworkers at risk, and he was terminated. And the arbitrator didn't hesitate for a second in upholding that termination. And if any of you practice labor law as much as I do, it seems that employees can do anything and get reinstated, but not in that case. That arbitrator was very forceful in making that determination. So that case goes a long way. And then there are cases, a couple of cases in which I think perhaps we'll talk about in a second, but I'll just talk about it now, with mandatory testing for employees after their rotation off of work. The unions challenged that about the employee having to be undergo mandatory testing every couple of weeks, and the arbitrator said that's a completely reasonable policy in the world of COVID, and overturned the union's grievance. So that case is called Caressing Care Nursing. So that policy was upheld as being reasonable. So sorry, Erica, just go back to the previous slide. So that's where we are on the COVID cases that I'm aware of. All of them very much favorable in favor of an employer trying to protect their workplace. The influenza cases are very interesting when we talk about where we're going, particularly for a large perhaps a rather large segment of the population who argue that the vaccines themselves are not safe. So in Canada, the influenza cases, all from the mid to late 2000s, break into two areas. I only have some of them listed here. Out west, the cases were all ruled in favor of the employer, and they were ruled in favor of the employer because the employer provided options to the employee if they chose not to undergo the influenza vaccine. So because they didn't fire the employee, but the employee would go on a leave without pay, or would take vacation, or would do whatever during the influenza season, and they were not losing their job, that gave the employee an option if they were adamant that they were not going to get vaccinated for influenza, because the employee had an option that didn't involve termination, the policies out west were all upheld by the arbitrators because it was what you'll hear me say for the rest of the presentation, because the employer created an off ramp for employees who didn't want to be vaccinated. Those cases were upheld. In Ontario, the cases aren't listed here, but Ontario took a completely different tact on this issue. And in Ontario, the majority of the cases in Ontario were ruled in favor of the union. And the main reason they were ruled in favor of the union, which creates some really serious questions for us moving forward, was because the arbitrators found that the medical science was not clear enough to demonstrate that there was a massive difference between those who were vaccinated and those who weren't with respect to the spread of influenza. I would argue, I'm not a doctor, and there may be a lot on this call who disagree with me, but I would argue that the medical science does demonstrate that people who are vaccinated do not contract or spread COVID at anywhere near the same percentage. In fact, the percentage differences are staggering, but there are lots of arguments about how safe the vaccines are being made out there. So that may or may not become an issue, but that's how the vaccine issue has been decided in the influenza cases. So not a clear legal picture at all when we come to that. But as I just said, so far on the COVID cases, the arbitrators have ruled very much in favor of the employer or the public right versus the individual right. So next slide, please, or skip that one. There we go. So the vaccine policies, and Tanya will walk you through how to create a policy. But I guess the $1 million answer to the question that you probably all tuned in to hear today is so to put it as succinctly as I can, I believe that you absolutely should have a vaccine policy for your workplace because of occupational health and safety considerations. And I believe that certainly the more vulnerable your workplace is in the sense of a healthcare setting, a daycare, a restaurant where you're interacting with the public, any type of business where there's large public interaction, you should be more thinking more about a vaccination policy. But the biggest question is that you shouldn't have. There needs to be an off ramp, so you need to go through a progression of off ramps for people who don't want to, for whatever reason, be vaccinated. And I break that into two categories. So let's assume for a second that you have a mandatory vaccination policy. You want people in the workplace to be doubly vaxxed to if they want, in order to come to work and interact in your workplace. So number one, if someone says, I don't want to be vaccinated, number one is to find out why. If it's a human rights ground, then that creates a whole different scenario that we could talk about for a while. But you have to deal with that as you would deal with any other human rights issue. They have a right to be accommodated. You have a duty to accommodate them to the point of undue hardship. So if they have a disability or a religious issue that's causing them to say, I cannot be vaccinated, we have to deal with that as we would deal with every human rights matter. More generally, what's interesting about the COVID-19 situation is that there are a pretty healthy segment of the population who simply don't want to get vaccinated. Whether you want to call them anti-vaxxers or not doesn't make any difference to me. They can just have their own political or their own particular views, and they don't want to be vaccinated. So for that segment, I certainly do not recommend any disciplinary response, no matter how passionate you might be about mandatory vaccinations. So then you have to go through what these off-ramps look like. First of all, would be, can they work from home? Is that a possibility to continue that? A lot of people, when I give this presentation, say, well, that's not fair to the people who have to come to work, to allow them to work from home. But you have to ask that question about whether or not they can continue to work from home, and can that be off-ramp number one. Number two would be, if they cannot work from home, is it possible for them to be in the workplace and mask continually, or work away from other people following the 6 foot rule, and somewhat be isolated from others in a way that makes it safe for the rest of your workplace. Obviously, very difficult if they're interacting with the public. The third off ramp would be is testing a solution to this. So and I'm surprised, and I said this last night on in another matter, I'm surprised that we aren't moving quicker to using daily testing the way they did with all of the sports that went on in the bubbles during all that time. That we're not using daily testing as a way to deal with this issue for those who politically and for their own particular reasons do not want to be vaccinated. So I might be ahead of the curve on this, but certainly daily testing or testing 2 or 3 days a week for that person, so you can indicate that they're obviously don't have COVID and they're safe in that way as a solution to this. That may or may not be a solution. I'm certainly, someone just said about it not being reliable. I'm certainly not talking about using what we currently have as that rapid testing that may or may not be reliable as a solution, but we're very quickly moving towards, and my understanding is that the technology exists for there to be a reliable test that you can do in the moment. So it has to be reliable, obviously, or you have to tell them if they want to come to work, they have to have a negative COVID test. As we slide down the scenarios, we get to some of the more controversial ones. I say they're controversial. I don't say they're controversial, but others do. I certainly think, and this is where I sort of put my neck out, but I certainly believe that you have the ability under a vaccination policy to tell these folks that if none of my prior off ramps work, and there's lots of people commenting in the chat group here about whether testing works or not, and I'll leave that to your own individual determinations. But if you get down the list and you haven't solved it yet, then you can move towards more strict measures, which would include having the person go on to take a vacation leave for a period of time until we get through this, or use some other type of lieu time that they might have. So they would quote unquote go on some type of paid leave that they have already earned and that they're entitled to. And then we come to perhaps the last off ramp on the list, which they would go on an unpaid leave. Lots of arguments about whether that's a constructive dismissal and how unions would react. I'm fairly comfortable to say that based on the influenza vaccination cases out west, that there's a very strong argument to make that if you went through the whole checklist, the whole off ramp that I just went through, all the off ramp options, that you could move towards an unpaid leave for that person, only until such time as we reach the quote unquote herd immunity, because very shortly, perhaps by the fall, we're going to be in a situation where we have so much of our population vaccinated in Nova Scotia that additional 20% is not going to matter. And that's Dr. Strang or whatever makes that call. It's somewhere in the low 80% of the entire population being vaccinated that we would get there. And so this leave of absence without pay is not forever. It's only until we get to a situation where we're comfortable that we have herd immunity in our population, or the person's prepared to mask, or that's a solution when no one else is masking, they're prepared to mask, or we move forward with a much more progressive testing policy to ensure that they're safe. McGinnis Cooper lawyers have said the same thing since March of 2020, which is every COVID question you come across with your employee, you should avoid there being a disciplinary response or a termination. That's just not going to play out well. But coming up with some type of softer measure, following the off-ramp progression that I just went through, I think can really get us where we need to be. Just to pick off some of the questions that we're jumping in on here, I strongly believe you can certainly require employees based on a vaccine policy to advise you whether or not they've been vaccinated. You knowing whether or not they've been vaccinated is critical to your obligations under occupational health and safety. And I'm fairly confident that that's not a privacy issue. We've always been entitled to ask employees certain questions. So asking employees to demonstrate that they've been doubly vaccinated, obviously, if they tell you they have, we're going to believe them and we're not going to require it. But if you ask an employee whether they've been vaccinated and they say they're not going to tell you, I certainly have a problem that that's a relevant question for you to ask. And people are jumping in about privacy issues, but I certainly think that the occupational health and safety issue and the right of the employer to maintain a safe workplace. I guess I'll back up. The employee doesn't have to tell you if they've been vaccinated or not, but if they want to come to work, they have to tell you. So again, the employee has an option. The employee has an option to say, I'm not going to disclose my vaccination situation, and which gives you the option of saying that's fine. Then you're going to have to take a leave or an unpaid leave, or we're going to have to work through something else to work through this. But I certainly don't believe that it's a violation of privacy for you to ask the question and only have people in the workplace that you're comfortable that you know what their vaccination status is. So I certainly don't believe that that's where you get to when you get to protecting private health information. You're certainly not going to share with everybody else what one individual's vaccination status is, but you certainly can let your employees know based on your vaccination policy what it is that you're requiring. But you're not going to share that information with the workforce at large and post a daily list of who's vaccinated and who's not. We're absolutely not going to do that. But the employer, I say, definitely has the right to know. And we're certainly going to consult with the unions in advance. So the next slide. So those are my comments. I know a lot of questions came in when I was talking that I'll look at when Tanya's talking. But certainly to recap, you should turn your mind to a mandatory vaccination policy. The critical aspect of it is it has to be non-disciplinary in your response, and you have to pay attention to what your off ramps look like, and you have to go through a sequence of off ramps, and obviously it's important, and I think there's certainly the question of you're making an individual decision for your own individual business as to how you want to approach this, and there is some pushback on the comments, but you really got to pay attention to your occupational health and safety obligation under the occupational health and safety legislation. That is real legislation, and it has real teeth to it. So with that, I will turn it over to Tanya.
Great, thank you so much, Ian. And thanks to Karen as well. So up until this point of our presentation to you today, we've been able to provide you an overview of the global, the national, and also the local context of COVID, as well as looking at that legal backdrop for how you go about developing policy related to immunization. So in this part of the presentation, I'll provide more of a back to the basics 101 overview of how you develop policy and take you through the various components of policy development. And then through each of those components, I will insert some of the considerations you may want to be thinking about when you're developing an immunization policy. And just to reiterate, it is not a one and done policy. information is coming to us, if not on a weekly basis, on a daily or hourly basis. And so we need to be aware as sand is shifting under our feet and understand that this policy, probably of the main policy in your organization, will be changing as new information becomes available. Next slide. So when you think about what drives us to develop policy, there's really three main areas. So the first thing would be when we need to be in compliance. So that may be in compliance to the corporate direction or legislation. We're also thinking about policies when we want to seek changes in behavior in their workplace, and also if we need to provide or guide staff in how they go about making their decisions day to day in the workplace. Next slide. So regardless of the drivers, there are some questions that any organization needs to ask to determine first if they need a policy. So it's really starting with your why. So I won't go through all those questions, but you need to ask yourself things like, does a problem exist? And can anything be done about that particular problem? Or will it serve to clarify some ethical, legal, or professional practice issues that you have? So answering yes to any of these questions will probably signal to you that you do need to think about developing a policy. And when you answer the question that you want to have a policy developed, you also want to take inventory of other policies that may exist where there may need to be some revisions to existing policies, or if you have policies that are existing that might actually contradict the policy that you're about to develop. So next section, there we go. So I'm going to take you through about 7 or 8 different sections of policies or different components of policies. And it's really just kind of that hands-on policy 101 to be able to identify how you go about doing it in a more structured, formal way. So the first one, which is probably your hardest piece of work, is developing your policy statement. And it is the most important part because it really tells your staff and your employees and the public what the employer's position is on that particular issue. And when you're developing your policy statement, it needs to be clear, it needs to be very specific, and it provides direction to looking at evaluating your accountability, your effectiveness, how efficient your organization is. So that policy statement, when you're thinking about developing it, you have to think about style, your tone, and you want to keep it short so it's simple and easy to use. So think about, language that's commonly used within your organization. So you're not taking something maybe from one organization, as Ian said, about kind of the copy and paste. Although we're providing you this information today, it's really important that you use language and terms that your employees will understand and it would resonate with them. So I'm going to give you an example of what the policy statement may look like in a vaccination policy. So the My Organization, you can insert whatever your organization is. And so it's talking about a statement around being committed to maintaining a safe work environment. It's talking about vaccination is recognized as a cornerstone of preventing or decreasing the effects of COVID. And also your commitment as an employer to comply with any of the recommendations from your chief medical office. So it's really setting the stage for your policy as you move forward. The next section is around definitions. And sometimes we think that the definition section is really easy, but it can actually be a very, very challenging for a couple of reasons. So first, you may have definitions that you think are words that you're using within your policy that you think are very common and commonly understood. And an example of that would be employee. So how do we define employee? If you are relying on your policy if you need to enforce it later, it's very important to ensure that those terms are very clear. So who's in the bucket of employee? Are they contractors who work with you, or are they people who are casual? Are they people who are, your full-time permanent staff? So you need to turn your mind to very clearly defining who an employee is. And if in doubt, I think you need to really take some of those definitions back to a working group. And sometimes in some organizations, what we'll do is ensure that not only on the front end when you're defining definitions that you're going to use going through your policy development, it's important to kind of bring it back and have a stakeholder group, whether, you know, it's a group of employees. Also, it's important to talk to your unions, as Ian had said, and that allows, you know, to get some feedback on just ensuring that clarity is there, that people understand what you're speaking about. The third section is the purpose, and your purpose is really, as I introduced, it's really your why. Why are you developing this policy? And so you want to ensure that when you're talking about your purpose, that it's very specific and very precise. You don't want to be using terms that are really general, things that are ambiguous, that they're not really clear. You want to ensure that it's concise. I would say that you want to use maybe 1 or 2 sentences. You don't want, you know, paragraphs around the purpose of this policy. And you want to make sure that it's goal oriented, because really this is telling you why you're doing it. So what is the outcome and what is it that you're trying to achieve by having such a policy? So let's see what that would look like. So in COVID vaccination policy, I'm suggesting a couple of definitions here. You may want to expand on that depending on the type of work environment that you have. So things like who your customer is, how you define your employee, what does immunization mean in your organization, and your personal protective equipment, how is that defined? So those are some, but certainly not all of the words that may need to be defined up front in your policy. And then go into your purpose. So this purpose here is really looking at protecting employees and customers from preventing the transmission and decreasing the risk of COVID outbreaks. And it can likely just stop there. I did provide an extra line there to say that, you know, in some high risk or, for example, health environments, there's some specific guidance in some of the national agencies that are working in this space. So you may want to include something like ensuring the immunizations provided to employees pursuant to the Canadian Immunization Guide or the National Advisory Committee on Immunization. And we hear about those groups in the media. Next slide. So your first 3 sections is probably where all your heavy lifting is going to happen. That's where you spend a lot of time ensuring that you're defining things, that you're understanding why you're doing it and what your position is with respect to immunization for your particular business or organization. Now we're moving into the application. So application is really, who does this apply to? Who does this impact in our organization? And so again, we have to talk about whether or not it's your employees. Does it include people like your visitors, your shoppers, contractors who come in on a regular or irregular basis? All of those considerations need to have a conversation and to determine very specifically who your policy applies to. And I would suggest that's where you would also want to have some consultation and get some advice as to how far reaching you can be with your policy and who it applies to, because that may create some challenges for you later on. I also put in there to consider who the policy does not apply to. So for example, are you specifically stating that individuals who have medical evidence that there's contraindication for having a vaccine, would you include that and be specific about that in your policy? Next slide. So I would not normally recommend that procedures become part of a policy, because really your policy is very much your position. It talks about the what. Procedures are more around the how. And it really is a lot of detailed information that would normally support a policy. But in this particular situation, when we're developing this type of policy, I do recommend to have some high-level broad statements around procedural information. So let's maybe just jump to the next slide there, Erica. We'll take a look at what it might look like. So here for the application, I would say that the policy relates to all employees for X organization. And then I have two points here under the procedures. The first one is really looking at, what are the accountabilities in the various levels of the organization. So it could go from, very broad to from the CEO all the way down to your employee. So it may read, for example, your CEO is responsible to implement the policy. And when you get down into employees, you may want to have something really specific around, do employees need to tell you whether or not they're vaccinated, in the conversation that you were discussing with Ian, or are employees, required to fill out any forms, or are employees required to adhere to PPE. So whatever those very specific requirements are, that would be included in those sections. The other, if you could just go back, Erica, for a minute. So this is also kind of part of that conversation in the legal side that you were talking about earlier, but it's around whether or not you're looking for valid medical exemptions to being vaccinated, and what you're going to require from your employees, and what if they're not going to be vaccinated, what are those off-ramps that they will be required to do to be able to continue to work. So for example, will they be subject to work restrictions? Would they be wearing PPE, and so on? And so that can be a little bit, many businesses and organizations are simply looking for a policy that addresses immunization and that they're encouraging their employees to be immunized. But larger organizations that have high risk need to be kind of considering some of these more controversial concepts. So in this particular section, when we look at monitoring, as we know, we don't want to develop a policy and not have anyone look at it or ensure that it's actually being followed. So you do need to turn your mind to who is going to be responsible to monitor, and also how often will this policy be monitored. I would suggest, based on a lot of the changes that are happening with respect to information coming forward, you'd be looking at probably a 3 to 6 month review, if not even sooner. As significant information comes forward to us, we need to incorporate that into our policies. So let's take a look at the next section there. This is our last section, and it's really around references. So to ensure that you have credibility, and when you have discussions with your employees, or if there's challenges from your unions, you want to make sure that whatever policy you've developed has some credibility. So you need to look at the related policies that you've considered, any of the standards, whether they're within your province or if they're national standards, what legislation you've considered. All of that information needs to be compiled so that you know yourself that you've developed a solid policy and you're on solid footing. And it also provides, like I said, credibility to the conversations that may follow. So here you will see, from the monitoring perspective, you would write something along the line, and oftentimes in larger organizations, it may be human resources. Smaller businesses, it may be the CEO, but whoever it is that's assigned to monitor and have responsibility. And this says X years because we would typically review maybe every year or 2 years. But again, in this particular policy, I would be suggesting on a much more frequent basis. And then you have your management team. If in fact you are an organization that has high risk, and you were wanting to monitor the percentage of your employees who are vaccinated, then that management group needs to be identified to be conducting those regular immunization status data gathering as part of the ongoing monitoring as well. And under references, I just offered a number of, or a sample of references that you may want to look at. So, you know, your OH&S Act and regulations, that's paramount. So you need to really understand how this concept relates with that occupational health and safety legislation. Your Public Health Act and your Human Rights Act, those are all key pieces of legislation. And then again, back to some of the other national bodies that are providing guidance to us through this pandemic would be your Canadian Immunization Guide, your National Advisory Committee on Immunization, and your Public Health Agency of Canada. And all of this information is online, and I would encourage you to seek out what they're offering. So finally, just to add, the last section here is really about appendices. So if there are any forms that you're using, any additional information that you want to append or support your policy, that should be included in your appendix. And one of the areas that I haven't mentioned to you that depending on your size of your organization, you may want to consider is if you are a unionized environment, it's really important to ensure that stakeholder union engagement, and certainly my own experience would tell me that having those upfront conversations do identify areas where there could be potential controversy later. And it's not to suggest that all feedback that you receive has to be incorporated into your policy, but it does allow you to have those initial conversations. And oftentimes, you know, you do receive really positive ideas for improvement. So make sure you take that time. So this is just a sample policy. Obviously, to let you read it, we had to try to cut it in a couple of slides. But you'll see in the upfront, you have just information around your policy of how you're going to manage it. And then you get into your policy statement. And this really, again, sets the tone for your policy, the position of the organization. Then you move into your definitions. So again, sample of words that you may want to define, and depending on your own specific organization, you may want to customize those. Next slide. Then we get into our purpose. Our purpose is telling us why our policy exists. Our application section tells us who the policy applies to. And our procedure section tells us the how. How are we going to implement this policy? And then you end off your policy with how it's going to be monitored. And again, with that supporting list of references of how you came and what you considered to include and to be able to defend your policy later if you're ever challenged, so that you know that you've considered all aspects of things as an employer you need to think. So Ian actually went through this slide with you earlier, so I am just looking at the time. See, I will skip that slide, so we'll have some time for questions. And then maybe just to think about moving forward, we've talked today about our immunization policy, but it doesn't, start and stop, as you know, with just that policy. There's lots of other things to be considering. So for example, an acknowledgement of immunization, there was lots of good discussion around that in the chat around whether or not we would be asking our employees to tell us whether they've been, immunized, and if they've been doubly, immunized or choosing not to be immunized. So what's our position on that, and how do we document that? What's your position on paid time for immunization? If your employees have been scheduled during working hours, are we paying for that? working from home, and certainly the working from home piece, we very quickly, left our workplaces. Everyone went home, and things worked for the last year, and now people are coming back into the workplace. And I think it's really a time where employers need to kind of stop and reflect on moving forward. If we are going to be, having people work from home, what are the privacy considerations around the information that they're accessing about their work in the home? Who can work from home? Is it appropriate for all your employees to work from home? And how might that look if they're coming back to work? And are you going to be using it more of a hoteling space, or how are you going to schedule people coming to work, and also balancing that with working from home? How do you maintain employee engagement when people are working from home and some people are working in the office? And so you may not have experienced that before, but now moving into this as a more long-term relationship, how are you going to manage keeping people connected? And finally, your occupational health and safety obligations. Just because you have employees working from home, you still are very responsible to that legislation around a safe work environment. So those are, just some of the things that you need to consider if you're going to be working from home. PPE considerations around that. Excuse the pun, but dust off your cleaning and disinfecting policies. How is that different now than they were before? Respectful workplace policies, knowing that there's lots of different opinions regarding immunization and COVID, and people who have been positive with COVID, and how those judgments sometimes come into the workplace and create toxicity. So how are we going to deal with that? Isolation, essential worker definition, how we compensate for sick leave. It's a huge conversation that's being had across the country right now, and so on. So just wanting to kind of leave you with hopefully a good understanding of things we need to be thinking about as we develop our policy, but also, and more importantly, also to think about all of the things that you need to be considering moving forward in a later COVID and post-COVID work environment. So thank you very much. I know that there's been some monitoring of questions in our chat. And so we will turn it back over to Chris to see if there's questions that we can answer.
Great, thanks so much, Tanya. Appreciate it. Just before we jump into questions, I do want to say to Ian, I apologize. Ian Pickard, I didn't pronounce that correctly when I introduced you, Ian. So I think Tanya jumped in there and pronounced it correctly. So sorry about that. I was worried about Tina's last name. I got that right. And I obviously screwed yours up. So sorry about that, Ian Pickard, everyone. So thanks so much. So yeah, a very interesting presentation. Thanks so much. Obviously a popular discussion being had. One question that kind of was a theme throughout some of the questions that are coming in, and some of the questions that we've already received beforehand, was around asking new hires during the recruitment process if they've been vaccinated. And that kind of stemmed to another line of questioning with volunteers. If you're in a volunteer organization, are you allowed to ask that as well? So I don't know if I should just throw it to Ian or throw it to everybody. So I'll let anybody jump in to answer that.
I think I'll certainly take some of these questions, Chris. So first of all, with that question, and I saw that question coming in, it really is a cart before the horse situation. I just want to say, given all the comments on the chat line, that whether or not, as an individual business, whether you're public or private, a union or non-union, whether or not you decide to go in the direction of a vaccination policy is completely up to you. If you don't want to do it, you don't have to do it. But If you want to have a vaccination policy, and we're certainly saying you're able to have one, then we're talking about what that would look like. When it comes to and I would say that from the occupational health and safety perspective, we are saying you have to turn your mind to it. If you turn your mind to it and decide it's not a risk, then that's a decision you're making as an employer. So the question of volunteers and in the hiring process, first and foremost, you have to have, before you start asking people whether or not they've been vaccinated as new hires, you have to have a vaccination policy in your workplace. So you have to have a reason to be asking the question. You can't start asking new hires if they've been vaccinated and to prove their vaccination status if you're not invoking a vaccination policy within your workplace to begin with. So if you do decide and you do choose to have a robust vaccination policy in your workplace along the lines of what Tanya and I have talked about today, then you certainly can ask up front as to whether or not people have been vaccinated as part of the hiring process. That's just same for new hires versus current hires. But don't start focusing on current hires if you're not invoking it within your workplace. That could get you into trouble. Somebody's asked the question, which I normally cover, which is before you can have any type of mandatory vaccination policy in your workplace, vaccinations have to be readily available, which means you have to be able to go down the street and get a vaccination. You can't, and so this was more, the reason I left it out today is it was much more pronounced a month ago. You can't have any type of a vaccination policy in your workplace if somebody has to wait 2 weeks to get a vaccination or get an appointment. Now in Nova Scotia now, there are generally walk-in clinics for vaccinations, but before you have a vaccination policy, people need to be able to get the vaccination promptly. So the same answer would go for volunteers. If you're running a charity, you have volunteers who are coming in and out of your charity all the time to provide support. If you're requiring your employees to be vaccinated, or you have a vaccination policy, masking, testing, all the things we've talked about today, for your employees within your charity or your volunteer organization, then you absolutely can ask that same question for volunteers and ask people to be vaccinated before they come and volunteer for your organization. But take care of your own house first, and once you take care of your own house, then you can start to look at people who will be joining you. And I guess I should address the issue of customers. That's come up a lot. Obviously, I'm not an expert in that field. It's not really an employment field, but I think it's important to recognize that as a private business, you have a right to make whatever rules you want to make as long as they're not discriminatory under the Human Rights Act. So as a private business, you can make a rule to say that anybody who comes into your business would need to be vaccinated. Now, as we can see from the comment line, the comments in the chat, that may or may not be challenged legally, and it may or may not have a particular outcome, and I can't predict that outcome. But as a private business, you have the right to say that you don't want certain types, you want people to meet certain criteria before they come into your business. And as long as it's not a human rights violation, and asking somebody to be doubly vaccinated as of right now would not, in my opinion, be a human rights violation, then you're entitled to do it. Public sector, a little bit different, but certainly private sector, you have the right to decide who's coming into your business and who's not, subject to human rights issues. The legal challenges will come, as the chat line is saying, and we'll see how that all works out. But as a basic starting point, as a private business, you can make those decisions.
But also just to add on, sorry about that, Chris. I would just add on to Ian's point is we're seeing in the news in the last couple of days, universities are starting now to turn their mind to this as well and making some decisions. So we see that if you're vaccinated, online campus, not vaccinated, on campus, and then if you're not vaccinated, it's being redirected to online learning. So, just in different contexts, people are, all being challenged with how best to deal with this situation.
Great. Yeah, no, great point, Tanya. Thanks so much. And I think this kind of stems through the next question. You might have already answered this, but with the hospitality, in particular, the hotel sector, what about your travelers when they're coming in from a different region or a different country? And I guess that kind of stems down to whatever you enforce as a hotel, but I'll let you answer that more specifically.
Oh, you're right. You're right, Chris. I mean, I guess in hotels, particularly the larger chains, they're going to make their own decisions. I don't think that we're going to go towards a vaccination passport scenario, but I mean, Nova Scotia's already made the rule. I mean, it's interesting to see some of the comments in the chat line, but let's go back to first principles. Nova Scotia already has a rule in place right now that in order to come to Nova Scotia without having to isolate for 2 weeks, you have to be doubly vaccinated, right? So any hotel can assume that somebody's either been doubly vaccinated or has done the 2-week isolation before they show up at the hotel. But if the border's allowed to say, have you been doubly vaccinated, then any hotel could individually decide to say at the time of reservation, have you been doubly vaccinated? And again, let's remember that it was in the news last week, White Point, which is one of Nova Scotia's premier tourist destinations, has already said they don't care if you're from Ontario, whether you've been doubly vaccinated or not. They're not going to allow you to stay on their property, which goes to my point that individual businesses can make individual decisions about who they want to do business with, right? So hospitality industries, restaurant industries, I'm not suggesting this is easy. It's a very difficult balance between occupational health and safety and creating a safe workplace for your employees versus being open-minded to what the public wants or doesn't want as far as requirements on their participation in your business.
Great. Thanks, Ian. And I guess this would kind of stem through to the next question we have here around mandatory masking. I guess that would just stem through the same kind of thing you just covered there as well, Ian. Just depends on the business.
Again, I mean, people are raising lots of good points on the chat about certainly if somebody all of a sudden ends up being on a leave or somebody all of a sudden is wearing a mask, they might as well have a sign on their forehead that say, I'm not doubly vaccinated. I totally get that point, but it's their individual decision as to whether or not they get doubly vaccinated. And if they don't, then the employer can say, well, we're going to have a masking requirement or a testing requirement or whatever is applicable in the circumstance. So it's whatever the employer can do to best balance. And one thing that we haven't talked about today, which I hear about every day, is, and it's mainly from unions, is 75% of the workplace is doubly vaccinated. They've gone out and, in the union's opinion, taken care of themselves. What are you going to do, employer, about the other 25%? Are you going to let them come to work every day and in the union's argument, impinge on the safety of the 75% who have been doubly vaccinated? So the employer's getting it from both sides, right? Which what it makes to make it very difficult, no different than times gone by, very difficult to be an employer. But the employer's getting it from both ends. So I think the employer is very much entitled to take the necessary steps. If that means the employee in question wears a mask or something else happens, then I'm perfectly comfortable.
Okay, great. And this may have been answered in the presentation, so apologies if it was, but so with human rights in mind, how do we balance protecting employees with a protected ground of irrational fear of contracting an illness or disease?
Yeah, and I'm glad you asked it. I did address it in the presentation, Chris, but I think it's important to go over again. All of the comments that I've made in general do not apply to somebody who has a legitimate human rights ground for their particular reason for not being vaccinated. That person has to be dealt with through the whole process, very well laid out process to manage somebody with a human rights issue. We have to look at the duty to accommodate. We have to accommodate to the grounds of undue hardship. We have to, maximize our efforts to look after that employee. But I would, again, coming back to the comments, they're interesting because anybody who alleges a human rights ground in Nova Scotia, basically the rules of privacy disappear. That person has to disclose everything about their condition to satisfy the employer that they do have a legitimate human rights ground, and the employer can't accommodate them unless the employer knows everything about the condition. And the law is effusive with those comments, whether it's the Human Rights Board or arbitrators. You can't say you need to be accommodated without disclosing all of the information around the accommodation. So anybody who wants to allege an accommodation issue has to disclose all of the issues at play to allow the employer to accommodate. I just want to, Chris, just because it came through a lot, and I don't want anybody to read into what's in the chat line and me not answer this question. This issue about being sued privately for doing this, I mean, there's no real basis for that. The law in Canada is based on a principle of negligence, and the negligence law is based on a test of what your peers would do. So as long as, if today 7 out of 10 of your peers would make a decision on a particular way, whether that's to have a mandatory policy or not, then you're fully protected today, even if 6 months from now the law changes and the science proves that the vaccines were not safe. It's about today. So as long as today your peers would make a particular decision, then that decision is protected at law. It's all about what the reasonable person would do in the same situation as you. That's how the law works in this country. That's how it's always worked in this country. So as long as you're making a decision that's in conformity with your peer group, then you're protected at law. I just want to make that point.
No, that's great, Ian. And you've done a great job for me just going through the chat and getting some of these questions out. So thanks so much in addressing those. One last question here, and it came in the chat that I was interested myself here. Would you recommend an acceptable form of proof of vaccine? So if you're asking an employee for a proof, is there a form for that? And should you keep record or storage of that form?
Yes, I mean, and I guess that reminds me of an interesting question that was on your initial list. The only vaccines that I'm talking about are the ones that the Canadian government has approved. Rightly or wrongly, I don't know anything about that, but we can only as citizens of the country and business owners in this country operate based on the vaccines that have been approved by the federal government, number one. Number two, every Nova Scotian has that vaccine document that they get when you get your second vaccine. We all get the email. It shows that we have both vaccines. That's what I would ask to see. And again, I'm not trying to be draconian. If you ask an employee if they've been doubly vaccinated, or say you can only come to work if you're doubly vaccinated, we all have to trust our employees. If somebody says they're not doubly vaccinated, they told me in the lunchroom, then you can go ask them to see that email that they got. Just so you know. So the only thing that I would accept would be that email that we all get that shows the dates of our double vaccinations.
Great, awesome, thanks so much. So unfortunately, we're out of time here, and I know there's a slew of questions that have been coming through. So my colleague Kayla has been keeping track of everything. So we're going to follow up with Ian, Karen, and Tanya after this if there's any questions that we might have missed, and just in the interest of time, and we'll be following up with a follow-up email to all those people that registered and attended today. So thanks so much. So I wanted to extend a huge thank you to Tanya, Karen, and Ian for their time and expertise today on how our members can create a vaccine policy framework for their employees. Keep an eye out on our fall event schedule as we announce more in-person events at halifaxchamber.com/events. And we're looking for business after hour hosts. Are you interested in showing off your venue and event hosting skills? Contact Kayla Lynch at Kayla@halifaxchamber.com. This event was recorded, and we will make it available on our YouTube channel shortly. I hope you have a great day and enjoy the end of your week. Thanks so much, everyone. Take care.
Thank you.
Thank you.
Thank you, everyone.
Thanks, everyone.
Bye.